Welcome to Pennsylvania Newsmakers, and as always, thanks for watching. Well, Dr. Stuart Shapiro writes about the bedrock is crumbling. We'll find out what that's about. And then the Secretary of the Budget, Charles Zogby, is in the House. He will weigh in on the big budget battle in the state capitol. All of that follows these words.
This is Pennsylvania Newsmakers, a fast-paced, unrehearsed weekly discussion with and about the leaders who shape your world. And now, here's your host, Terry Madonna.
Well, we're here today to chat about a particular situation with the nursing homes. I also want to talk with Dr. Stuart Shapiro. I'll introduce him now. Doctor, welcome. As always, want to talk a little bit about an important subject, Medicaid expansion. It's been on the table in Harrisburg for the better part of 2 years now. What will Pennsylvania legislature and the governor do about Medicaid expansion? How does it affect nursing homes? And then Charles Zogby will come on. He's the Secretary of the Budget. This huge battle is going on about the Pennsylvania state budget this year. We'll get into that. But first, Dr. Shapiro, I love this title. The bedrock is crumbling. And we're not talking about fracking for a change, right?
You are not talking about fracking. And I must say that your next guest has real challenges that he and the Governor Corbett are facing. And we're going to talk about nursing homes, but they're hitting those challenges head on. And they're really quite right that we have to get control of unnecessary spending and spending that's some of the spending's that out of control before they can even think about revenues. But they are focusing on priorities. And one of the priorities that is in the budget and needs to stay in the budget as they move forward is the funding for senior services. Right. And when I talked about the bedrock is crumbling, because I always come back to exactly what you asked me, we're really talking about not fracking, but we're talking about how nursing homes, which have been the bedrock of senior services for the last 2 decades, are now going from what has been a very stable situation where people can go to live in dignity as they spend the rest of their life where there are no other alternatives for them to be cared for safely. They can't be cared for at home.
Before we get into that, and I want to delve into that, explain this. There's Medicaid. If Pennsylvania adopts Medicaid, it would immediately bring something like $400 million. That's a number I keep hearing to the state. But the governor has another Medicaid proposal called Healthy PA that would allow individuals to take, the state would get the Medicaid money, individuals would get it, they would go in a private marketplace. Without getting into the details of that, do both plans bring money into the state that would provide help for these senior services?
The answer is sorta. The governor's plan will bring in money to Pennsylvania, and it will make sure that the number of people on welfare today does not go from 1 in 6 Pennsylvanians to 1 in 4 Pennsylvanians. If that were to happen, it would draw money. If the governor's plan was not adopted and you went to standard Medicaid,
okay,
that would transform 1 in 6 to 1 in 4. If you did that, the standard Obamacare, not the Corbett plan,
right,
the standard Obamacare, done in many states, would drive dollars away from seniors who need those services in Pennsylvania's nursing homes, which is why nursing homes across the state have written letters to legislators that have said they need services in the nursing homes, and expanding Obamacare into Pennsylvania is not going to work.
Not going to do that. Now you make the case in an editorial that you wrote that was in a variety of newspapers in the state, in which you talk about the reduction in the operating margins for the nursing homes. So you feel there's a genuine crisis. You even use the term. You use the term code blue.
I do use the term code blue. Over the last 5 years, between 2007 and 2012. The operating margins in all Pennsylvania nursing homes have fallen from 3.2% down to 1.2%, which is barely able to make the ends meet. It means they can't expand staff. They can't buy equipment that's needed. They can't use technology. It's also even worse for those nursing homes that care for a lot of people on Medicaid. And for those nursing homes, the margins are down to 0.3%, which is why the governor's budget has in a 1.7% increase in funding. And it's absolutely essential.
All right, we're going to continue this discussion because there are a couple of other questions that I have about this relationship between them. I mean, what's the status of skilled nursing homes? I mean, given the number of people who use them, my mother, for example, spent her last days in one and how important they are. We're talking with Dr. Stuart Shapiro about an incredibly important subject. We'll be back in a moment.
This broadcast of Pennsylvania Newsmakers is presented by the Pennsylvania Chamber of Business and Industry, the statewide voice of business. This broadcast of Pennsylvania Newsmakers is brought to you by the Pennsylvania Highway Information Association, the go-to source to learn about transportation projects and issues. Please visit pahighwayinfo.org. And by the Pennsylvania Manufacturers Association. Business in Pennsylvania is our business.
Hi, I'm talking with Dr. Stuart Shapiro. We're talking about Medicaid expansion. It's been debated for a couple years. It's a hugely important topic. We're also talking about its effect on Pennsylvania nursing homes. You were making a point as we went to commercial break.
And I'll make part of the same point again. Obamacare took $14 billion away from seniors to expand Medicaid for the poor. We're trying to prevent that from happening in Pennsylvania. The seniors in Pennsylvania need services. A few weeks ago, 600 caregivers of Pennsylvania nursing homes came to the Capitol to rally to say, make sure that the legislature keeps what the governor's proposed and also adds a special access add-on for the nursing homes that care for high Medicaid. Right. It's interesting. I was visiting a nursing home, though, 2 weeks ago, and one of them said, Stuart, what else can we do? And I said, well, write a letter.
do the lobbying, right?
I said, write a letter. And the woman said to me, I'm going to do better than that. And she was a director of nursing, and she turned to her wingman, the wing woman who was the administrator, and said, I'm going to get a lot of staff to do it. And then she called another nursing home, and in the last 2 weeks, there were almost 4,000 handwritten letters from patients.
Nobody handwrites a letter anymore, right?
We did. They didn't spam the legislature with emails and all those other things. They got, it was amazing to me. These were people who wrote a From the Heart campaign saying, take care of our seniors. And it's very important as the budget goes into its final negotiations that seniors are able to have their services so they live in dignity in their nursing homes and they don't become the warehouses of 30 years ago.
Isn't the fundamental question now about that really in the hands of the federal government and HHS, whether they adopt Healthy Pennsylvania?
No, it is absolutely right now, today, and tomorrow, in Pennsylvania's hands how they fund how much dollars they put into Medicaid. We could talk about global budgeting, and you're going to hear from my good friend Secretary Zogby about their budget difficulties. But the governor has said, let's fund the need to have, and we need to have services for the elderly in Pennsylvania.
What's your latest sense, as we discussed, knowing that the budget situation is very fluid, that's one word to use. What's your sense about where it all stands?
I think you'll get that better from Secretary Zogby. I'm here to say, no matter what happens, let's take care of the seniors. They're the ones who need to have services, and the nursing homes where they live, where they're frail, where they're sick, where they're elderly, are the place where we need to prioritize the dollars. But these people don't have other alternatives.
You know, typically in Pennsylvania, if you go back over the last couple of decades, more than a couple, because we have, I think now, the fourth oldest population as a proportion of the total population of seniors, the lawmakers have been sensitive, you got it, politically sensitive to the political clout that seniors have. But before I let you go, you argue in your editorial about the low margins that nursing homes have compared to other suppliers of health services, and that's another reason to help out. I mean,
absolutely. The average number of people on Medicaid is 65% in Pennsylvania's nursing homes. They can't make up the margins like hospitals can from insured patients.
Right.
They can't make it up from private pay patients. This is a crisis, and the elderly in Pennsylvania in nursing homes need the care, and we're just hopeful that the legislature will continue to make them a priority, as the governor has.
All right, thank you, Dr. Shapiro. Thanks for the update. All right, coming up, we're going to hear from the Secretary of the Budget, the guy in the know. We'll find out what the Corbett administration wants, what is its bottom line out of the legislature as these negotiations move towards the June 30 deadline. See you in a moment.
This broadcast of Pennsylvania Newsmakers is brought to you by Pennsylvania Credit Union Association. Pennsylvania Credit Unions, where people are worth more than money. To find a credit union that is right for you, check out ibelong.org. And by the Energy Association of Pennsylvania, Pennsylvania's energy information source. This broadcast of Pennsylvania Newsmakers is presented by the Hospital and Health System Association of Pennsylvania, working towards a healthy Pennsylvania, and by the Pennsylvania Coal Alliance, representing companies involved in America's most affordable, reliable energy source. To learn more, visit pacoalalliance.com.
Well, Charles Zogby, the Pennsylvania Budget Secretary, is sitting across from me. He's having a lovely time now as the legislature tries to figure out what to do with the budget. But actually, they're doing with numbers. That's something that you do best, right?
That's right.
You love these numbers. All right, let's get down to the hard line. This week, past week, it appeared that there was some, I'll call it modification of the position of the governor on. You're insisting now that before you adopt the Pennsylvania budget, before he puts a signature on a bill, he wants pension reform, and maybe you'll look at some kind of revenue enhancers. Is that an exaggeration on my part?
No, I think that's close to the mark, Terry. Look, we're $1.5 billion in the hole as we sit here today. And to look at a budget just within the existing revenue framework is very, very sobering. There's no additional money for basic education priorities, higher education, critical human services needs like our intellectual disabilities, waiting list, people with physical disabilities on a waiting list who can't be served. And no one wants to cut any deeper. We've been through that in past budgets. But what the governor said is that we've got to make progress on the cost drivers that are driving this budget deficit. And the biggest piece is our pension system that are right now on an unsustainable course. We're looking at $600 million in new pension costs in the coming year alone.
Is that pushing $2 billion total out of the budget soon, out of the $29 billion budget about? Is that what?
Yes. I mean, it's pension costs are crowding out our ability to fund other basic priorities. And so what the governor said is that before we have a discussion on additional revenues to address key priorities, we've got to address the cost drivers in our budget, and the number one cost drivers is pensions.
All right, let's go to the second issue that's been hotly debated, and it's liquor privatization. The House sent over a bill, not a single Democrat voted for it, complete privatization. I think, correct me if I'm wrong, more to the governor's liking.
The governor supported that, yes, sir.
That's exactly right. Now, you got the Senate that looks like it's prepared to do, we think, a modernization approach, which means you keep the liquor store operation, but you do licenses, you expand beer sales and wine and spirits. Only Pennsylvania uses that term. If that gets to the governor's office, would he sign that? Do you guys support? Will you support that?
Well, look at the governor's
more revenue.
The governor's been an active part of these discussions.
Sure.
The House bill would, over time, generate $1 billion, and Leader Turzai's done a great job advancing that. The Senate has had difficulty embracing it, and I think the reality is that they don't have the votes for a more the kind of ambitious reform proposal
privatization
that the House passed. Yes, and so I think the governor's been working. Lieutenant Governor Cawley's been working with the Senate leaders. They're trying, as you know, finding that magic alchemy, right, that can get 26 votes to get it back over to the House to get something to the governor's desk.
Modernization would still give you something that that you want would be additional revenues without having to go to fees and taxes of some kind.
Well, it remains to be seen whether the Senate product that's being discussed would generate revenues. I think additional revenues. I think it's not necessarily a budget item. I think right now the key is focused on greater consumer convenience, greater consumer meeting the needs so that moms don't have to run around all day to different places, or people can go to, say, a grocery store to buy a bottle of wine, or could maybe get some wine from a beer distributor, trying to make a difference in people's lives in terms of greater convenience. I think that's the focus, not so much a budget issue in terms of picking up additional revenue. That may be something that does come out of it, but it really is more about meeting customer needs, not necessarily budget needs.
All right, we're going to run to a break. When we come back, there are a number of other aspects of the budget that I want to chat with you about. I mean, there's this whole business of the severance tax. You've been asked this question 1,000,000 times. What happens to the impact fee? This is pretty important. I want to talk with Secretary Zogby about that and a few other things in a moment.
This broadcast of Pennsylvania Newsmakers is presented by Highmark Blue Shield, changing the way health plans work for business with a variety of plan options for employers and more choices for employees. Information is available at highmark.com. Have a greater hand in your company's health. And by the Pennsylvania Healthcare Association, the future of long-term care. This broadcast of Pennsylvania Newsmakers is brought to you by the Pennsylvania Business Council and by the Pennsylvania Business Council Education Foundation.
Well, I'm talking with the Budget Secretary Charles Zogby about the, I don't almost know how to describe what's going on in Harrisburg right now. It's a difficult time getting a budget with a $1.5 billion deficit. Mr. Secretary, let's talk about one other thing. You have been asked this 100 times, and I think you and I talked about this when you were on the program before about the severance tax. That's the tax on the extraction of natural gas. It's per cubic feet. That's one way of taxing it. And you all are now standing back saying, well, maybe if we get what we want, we'll look at that. Am I right or wrong about that?
I think that's fair. I think, there is a lot of people clamoring out there thinking that it ought to be raised. Certainly, I think, your own polling data would show that, right? And look, we're raising $200 million a year from this industry through impact fees that are being distributed throughout the county.
Tax on each well. Go ahead.
Yes, being distributed to counties throughout the Commonwealth. What isn't happening is it's not coming into Harrisburg, into the general fund.
I got it.
And people feel like that should be a source of revenue, particularly when we're facing a $1.5 billion deficit. Mm-hmm. I think from the governor's perspective, the key issue is jobs. We know that natural gas, the shale activity, is producing wealth and income and economic activity in areas across the Commonwealth that haven't seen economic growth and prosperity for decades. We don't want to kill, the governor doesn't want to kill that golden goose for all those communities and the families that depend on those jobs. And we want to keep that industry here in Pennsylvania and grow it for the long term. But he is said that, again, if we can address pensions, and pension reform, if we can address progress on liquor, that he's willing to engage in a revenue discussion and not take the severance tax off the table.
Right.
He's not bought into it yet, but he's not taking it off the table.
All right, I want to talk about the governor in the February budget message recommended $300 million plus in education, about $241 million grant programs, obviously pretty important programs. You still committed to that? Are you still fighting for this education increase? We're talking about monies to the school districts.
Absolutely. I think the governor thinks that a great budget for Pennsylvania is money that includes more support for basic education, more support for things like pre-K, special education. The governor's February budget had
$20 million
for special education, the first increase in 6 years. He's also got a Ready to Succeed scholarship program targeted towards middle-class families, helping to defray the cost of post-secondary education. And as you referenced, the $241 million Ready to Learn block grant that's focused on making an immediate impact in student achievement in schools across the Commonwealth. I think the governor believes all of those things are important to do and need to be addressed in the budget, along with the waiting list for people with intellectual disabilities.
Before I let you go, I want to talk about Medicaid expansion. In the polls that I've done, both Healthy PA and traditional Medicaid expansion get, voters support both. They actually support your Healthy PA a few percentage points more. Notwithstanding that, it would bring in, I hear traditional Medicaid $400 million more. You're going to correct me on that. Go ahead.
That's a phantom number. It's just not real. We can't move people into the program quickly enough. The reality is that implementing ACA just on itself is costing the Commonwealth over $300 million, and then the Commonwealth as an employer another $79 million to bring our own health care programs for public sector workers into line with the Affordable Care Act. It's only the governor's Healthy PA waiver, where we fundamentally reform the Medicaid program and the benefit structure, that actually generates $130 million in savings this coming fiscal year, growing to over $600 million in the out years.
Now? I mean, correct me if I'm wrong. You've got the request from Health and Human Services. You're waiting on a reply. You dropped the work requirement, right?
The governor's office has been negotiating with HHS down in Washington, Health and Human Services, CMS, which is the Center for Medicaid Services. Right. On the governor's Healthy PA waiver. We're making good progress on that. I think ultimately the federal government is going to approve that and allow us to implement this plan. It's consistent with what they've done with other states. And in reality, it's the only path that we have that puts this program on a sustainable footing that Pennsylvania taxpayers can afford.
All right, look, thanks for coming on. As you know, you've been on a bunch of times. You're always welcome on a program.
Always a pleasure.
We want the point of view of the governor's office. All right, we'll see you next week for another edition of Pennsylvania Newsmakers, and as always, stay well.